Hi, I'm Dr. Jim Sublett, and I'm an allergist. There's a lot of conflicting information these days on the internet and in the media on just how to treat a child's allergies. Will a child outgrow their allergies? Will your child always be at risk when they're at school and in every new environment? Because the answers are complicated, it's important to have your child under the care of a board-certified allergist. Allergies and asthma are both very serious diseases facing children. Today we're going to unravel the conflicting information for you, make sense of it, and answer the question, why see an allergist?
Hi, I'm Dr. Stanley Fineman, allergist, and I'm here today with Betsy and her son Colin, and we're here to talk about her concerns about Colin's allergies. Could you tell me about your concerns?
Sure. Well, Colin's 4.5 and has had allergy and asthma symptoms since he was quite young, 6 months or so. I would say that when he gets a cold, it typically goes to the chest and the lungs, and we have to use a nebulizer on him. And he has had at least one severe reaction to cats that we ended up in the hospital for.
Wow. And
we recently found out that he has a tree nut allergy. He's allergic to about 4 or 5 tree nuts as well.
He's probably a very good example of a child who's predisposed to have allergies, who starts with an allergic march and then progresses. And what sort of precautions do you have available?
We certainly, when we're at school, we make sure that all the other parents at school know that if they bring in snacks for somebody's birthday or treats for the holiday, we ask that they not bring anything with nuts in it. Okay. And we do keep the epinephrine pen at school. Okay. And I carry one with us at all times in my purse or in our bag, so that in case he eats something that we're not aware has nuts, we're prepared. I have a 2-year-old son, though, who is not with us today. He's home, and he too, when he gets a cold, it goes right to his chest, and he gets wheezy and coughs, and so we use the nebulizer with him. We haven't used an inhaler with him yet, and I don't know about the food allergies, and that's actually a question that I have for you, is I'm not sure when we need to start thinking about introducing foods that might be prone to allergies with our 2-year-old, particularly nuts.
It's a big concern, and probably what we need to do is when you bring him into our office, then we can deal with that when he's here, and we'll probably expose him in a very cautious way with a graded challenge with all the precautions available. So I wouldn't recommend you do it at home.
Right.
You need to do it in a controlled setting. Can I ask Colin a question too?
Sure.
Colin, I'd like to talk to you about your food allergies. How do you keep people aware that you have a food allergy?
About this bracelet.
What does it say?
Nutso.
Nutso. It says allergy tree nut. So you remember now not to have any, what?
Nuts.
Nuts. Good.
So when he goes to somebody's house, if they want to give him a snack that might have nuts, what do you do?
Show him the bracelet.
Then we're going to take a look at your mouth, and I want you to open your mouth really big and say, really loud. Say it. Say it. Very good. Okay, good. So Colin, you look good. You sound clear. You also have a food allergy because you're allergic to nuts. So what do you have with you to make sure you're prepared in case you accidentally eat a nut?
This is our epinephrine injector that we carry with us at all times. And we also have our emergency action plan, so that if I'm not here when something happens, whoever needs to administer the epinephrine injector to him knows what to do.
Good. It's really the first line medication. And one of the things that we should make sure you know is that if you're not sure whether you should use your epinephrine auto-injector or not, go ahead and give it to him.
There's no reason Betsy should be confused about how to treat her children's allergies. Both children can be tested, diagnosed, and treated by a board-certified allergist. The allergist can then help Betsy understand her children's condition and develop an individualized treatment plan for each child. Allergy treatment, even with siblings, shouldn't be a one-size-fits-all approach. Thank you for watching, and tune in to the other American College of Allergy, Asthma, and Immunology segments about how an allergist can help you. Till next time, this is Dr. Jim Sublett, your host for this segment of ACAAI's series, Why See an Allergist? Because allergies and asthma are serious diseases, and that's nothing to sneeze at.